So many of you all are having questions about sacroiliac arthrokinematics. There, there, there is where understanding is lacking. So students are having questions about sacral nutation and counter nutation. So let's nip that in the bud. So with sacroiliac joint kinematics, we have a torsion where the ilium rotates so that the upper portion, and I was talking about this in class, the upper portion is going to either move anterior or either posterior relative to the sacrum. So you're going to either have posterior torsion or anterior torsion, or sometimes referred to as rotation anteriorly or rotation posteriorly, either or. So with posterior rotation, when the ilium rotates and moves posteriorly, it is moving in a sense the posterior direction relative to the sacrum. The sacrum is going to do something else, but I'll get to that. So right now we're just talking about the ilium, how it moves relative to the sacrum. So with things like single needle chest or double needle chest, you get a posterior rotation of the ilium. Now, what is going to happen with that posterior rotation? So you see this arrow right here showing that the ilium is rotating posteriorly, and this is in white. So this white indicates posterior iliac tip or rotation. So it's rotating posteriorly, and our torsion is used as well. So rotation posterior or posterior torsion or sometimes posterior tilt, all of those are used interchangeably. Now, relative to this posterior rotation, the sacrum nutates. So nutates, what is this doing, nutate? What we talked about? What other terms can we use for nutation with the base of the sacrum or what the sacrum is doing? Forward bending or flexion. All right? So if I sit right here and lie down and I do a single needle chest, I get a posterior rotation of the ilium on this side. Now, relative to that, on the same side, the sacrum is forward bending on this side. Now, since it is forward bending on this side, I can go deeper into that with what the sacrum is doing with rotation. So if it's forward bending on the right side, which way is it likely rotating? The sacrum. So if it's forward bending on the right side, it could be likely rotated to the left side. You gotta visualize this in your mind. That's why I got you recording it to go back and think about it. But we'll come back to that. All right, now, so if I squat, I'm performing a squat, right? So when I squat, what are my ilium doing? Good job. Posteriorly rotating. What is the sacrum doing?
Anterior, well, forward bending.
It's forward bending. Good job. So with posterior rotation occurs, posterior rotation of the ilium in conjunction occurs anterior or forward bending. I'm gonna say forward bending or flexion or nutation of the sacrum. All right. So moving on. When I get an anterior tilt, so say I'm coming back into standing from squatting. Now the ilium has to rotate anteriorly. Now my sacrum is gonna counter nutate. It's gonna backwards bend. You see? So as I go back into extension at the hip, my ilium are going to start rotating anteriorly, and my sacrum is going to backward bend. It's going to counter nutate. All right. So if you line this up, you look at the dark shaded where it says posterior sacral tilt. We also refer to that as sacral backward bending, sacral extension, or counter nutation. The white part, anterior iliac tip, represents the ilium going into anterior rotation. This says iliac tip. We're just gonna say anterior rotation or anterior tip. But counter nutation of the sacrum is occurring in conjunction with anterior rotation of the ilium. Okay? So now, if I do, say I go right here and I lie down, right? I do a bridging exercise. I have my patient to bridge. I'm going into hip extension. What is the ilium doing when I bridge? It's rotating anteriorly, and my sacrum is counter-nutating because I'm going into hip extension from a more flexed position. So now, since my hip is in this more flexed position, it's more posteriorly rotated, and my sacrum is more forward bent, in a sense. You see? Now, when I go into bridging, into more hip extension, now my ilium is going to anteriorly rotate and my sacrum is going to counter-nutate. All right? So, that describes your nutation of the sacrum and your counter-nutation of the sacrum relative to the torsion or rotation or the tilt of the ilium. That's pretty much, this is one slide that basically explains that. So now you have to know how to apply this. When it comes to therapeutic exercise, or when it comes to a mobilization technique, and you follow with a supporting intervention. So if I have a patient, right, and I know this patient has a tight hamstring muscle. So we know that tight hamstring muscles can cause a pulling of the ilium posteriorly. So if they are fixed in a posterior, if the ilium is fixed in a posterior position relative to the sacrum due to tight hamstring muscles, then what this person is likely gonna lack anterior rotation of the ilium on that side. So now, what technique can I do to help improve? What soft tissue technique can I do to help improve iliac anterior rotation if the ilium is being pulled into posterior rotation by the hamstring muscle?
The strumming and stroking at the insertion of the hamstrings.
So you can do strumming and stroking at the insertion of the hamstring. That would be very specific technique. Good job. You can do cross friction of the insertion at the ischial tuberosity of the hamstrings. Then you can do strumming and stroking of the hamstrings, or splaying of the hamstrings, techniques that you've been taught, or transverse manipulation of the hamstrings. That should make it to where the hamstrings become more extensible, right? Then you can follow that with a mobilization technique. Then you could do an anterior rotation mobilization technique. You remember that when you had a patient lying like so, and then you apply the anterior, as you move the hip into extension, you apply the anterior rotation mobilization at the pelvis. Okay? So those are like type of scenarios that you all will be faced with in doing. Say if a person has a tight or very tall iliopsoas muscle, we know the tautness of that can pull the pelvis into anterior tilt or anterior rotation or cause excessive anterior torsion, right? So how do we get this person to improve posterior rotation? Well, we can do an iliopsoas release, right? Now, you do an iliopsoas release. What mobilization would you follow that by?
Posterior.
The posterior rotation of the ilium technique. And then you just have to come up with a supporting intervention. You know, maybe you had a patient doing some hook line marching to help support what you have achieved with the posterior rotation of the ilium. Maybe you had a person do some standing marching. You know, you just have to think about it. Maybe you had a person doing some squatting. You just have to tie it in all together. But the crux of it is understanding this sacroiliac joint kinematics. Now, with these conditions, like if a person has restrictions at the sacrum and you think that they have decreased sacral mobility, well, you know specific techniques that you can do to influence soft tissue structures back there, such as bilateral sacral releases. And you can always follow bilateral sacral releases with sacral forward bending mobilization, sacral backward bending mobilization, sacral side bending mobilization techniques. I hope that answers everyone's questions about this. But another piece that I want to add to this as well. Nutation, I did put in here, occurs with squatting, lumbar forward bending, hip external rotation. So to get full maximum external rotation at the hip and ilia, a component motion that occurs with that. So if I externally rotate my hip and ilia like so, on this side, what is occurring with the sacrum? What is a component motion at the sacrum that is occurring with hip external rotation?
Flexion.
Flexion. So you have to have some forward bending of the sacrum with hip external rotation. Now, I'm sitting, right? But hypothetically, when I internally rotate at the hip and ilia, what is the sacrum going to do?
Extend.
Extend, backwards bend. Okay. So even with standing, I internally rotate. Typically, that should accompany some sacral backward bending. I externally rotate the hip and ilia. That should accompany some sacral forward bending. Okay. Now, in your practical, if you are faced with decreased sacral mobility, I will accept bilateral sacral releases as a soft tissue technique. Then you just have to bring it home with whatever joint mobilization technique that you're going to do to improve whatever case you get, in addition to tying in a supporting intervention. So everything has to be in alignment. I think that's it. All right, stay on.